The act of breathing contributes to the establishment of a welcome environment and the development of trusting relationships with caregivers.
What makes you here, Mom? I simply want to make sure that my baby is healthy.
The next step is to decide which charts to use by asking the child's name, age, and the child's problem.
May I know her name and age? Her name is Princess and she's 1 month old. Okay, Mom. Thank you for bringing her to the clinic and for being so concerned about her. May I know her birth weight? Her birth weight was 3.1 kilograms. Okay, so for now, let's take a look at her weight and temperature.
Upon weighing, she weighs 4.5 kilograms and has a temperature of 35.5 degrees Celsius.
Her temperature is 35.5 degrees Celsius. Has she had a convulsion? No.
Upon an assessment, the nurse determines that the infant does not show severe disease and local infection. She will now continue to evaluate the infant's feeding and growth.
Does she have any problems in feeding? No, Mom. Is she breastfeeding? Yes. How many times in 24 hours do you breastfeed her? 5 times every day. Okay. Does she usually receive any other drinks or food? Yes. How often and what additional foods or drinks do you give her? I give her milk twice a day.
Next is to determine the infant weight for age. Previously, the nurse measured the infant's weight, which was 4.5 kilograms. Continue to assess breastfeeding. When will you assess how an infant is breastfeeding? You need to assess the breastfeeding if the infant has the following: does not need urgent referral, is feeding less than 8 times in 24 hours, having mixed feeding. If the caregiver's answers indicate difficulty with breastfeeding, and lastly, if the child has low weight for age.
Okay. Has she breastfed in the previous hour? No, Mom.
If the infant has not fed in the previous hour, ask the mother to put her infant to the breast. Observe the breastfeed for 4 minutes.
Is it okay for you to breastfeed her today? Yes, Mom.
Look if the infant is being able to attach to the breast. Look for 4 signs of good attachment. Good attachment is essential for the young infant to feed well. Sarah appears to be well attached to her mother's breast when seen while breastfeeding. Then check to see whether the infant is suckling effectively. After assessing how infant is breastfeeding, the nurse then classify the infant's feeding problem and growth.
Since you're breastfeeding less than 8 times in 24 hours, you should increase your feeding frequency. You must breastfeed her as frequently and as long as she wants, day and night. Short breastfeeds are the main cause of an infant not receiving enough breast milk. The infant should continue to breastfeed till she is satisfied. Okay, Mom, I'll make sure to do that. breastfeeding promotes the growth of the baby and the mother-to-baby connection. The infant should be breastfed exclusively, and you should limit the amount of meals or fluids you are giving her.
Okay, ma'am. Thank you so much for giving me so much information about breastfeeding. I'll make sure I will breastfeed my baby properly.
Okay, thank you so much.